I think July 20th is a night that's going to live on in our lives for pretty much forever. And it was myself and Dr. Blok who were the two emergency medicine physicians that were on that night, leading a team of diverse residents. We had an intern who had been there for about 3 weeks since she had finished medical school, two other male residents who were our second and third year residents, and then kind of a slew of ancillary support staff. And when everything kind of really started happening was really about 12:30 in the morning that we had gotten notification that there had been a shooting in the area. And it wasn't really until about 1 o'clock when we first started getting our first patients in, most of them actually coming in by police car, not by ambulance, that we realized, gosh, this is actually something totally different than what we've ever seen before. What we had noticed was that pretty much right away we went into sort of gut instinct mode. And so it was adrenaline, it was instinct, it was, didn't have a whole lot of time to think. But what we both realized pretty quickly was that it was going to be coordinated chaos, and she and I needed to take the helm and really to become the leaders of our emergency department that night. And we had just a slew of doctors that came down to help us. So we had surgeons coming down, vascular, orthopedics, neurosurgery, everyone kind of descending upon the emergency department. And what Barb and I had to do really was to take ownership of the situation, to make sure that this emergency department was ours, and making sure that every single patient that came in through those doors was going to be able to walk out of our hospital hopefully in the next few weeks. As women, sometimes I think we kind of underestimate our leadership potential. And on that night, I think what we did was we actually were able to show that, you know what, we're two women doctors leading a team of 15 surgeons and residents and nurses and everything, and I think we actually were able to handle the situation in a way I would say that was both collaborative, was able to get the job done, and at the end of the day I think hopefully was done with a lot of compassion for all of our patients that walked in that door. You know, I think the biggest lesson is that doctors are actually human. We have emotions, and I know that's actually sometimes hard for us to think, because as ER docs we're hardened, you know, we've seen it all, we've done it all, and I think what I realized from this experience is that even though we've had all those experiences, at the end of the day, we're still human beings, and these things actually really do affect us. And the outpouring of support that I've had, just not from here locally, but also throughout the world in terms of our colleagues, I think has been so important. People who've been involved in other kind of mass casualty incidents who said, you know what, honestly, you may not sleep for 2 weeks, and that's okay. And you may wake up a year from now and have a nightmare, and it actually may stem back to what you saw and what you did on July 20th. And you know, I think that's been really important, is to really understand that although we're doctors and we're trained to take care of patients, at the end of the day, this actually really does really truly affect us. The hospital had its own sort of disaster plan in place, and it had some sort of process for debriefing afterwards. But what we realized pretty quickly was that debriefing can't stop at 1 week or even 2 weeks. It has to really continue on, you know, potentially for a few years. And in whatever social circles that may happen, and I was fortunate enough that I was able to have everyone over at my house who had worked in the emergency room that night over, so we could talk about kind of the events. And to talk about our feelings, and also to sort of normalize the fact that we hadn't eaten, we hadn't slept, that this had really affected us in a way that no one had really thought. And I think those types of sort of grassroots, sort of impromptu kinds of meetings are things that are going to need to continue to happen in order for us to process this and to make sure that we stay okay ourselves. And I think that's sometimes hard as physicians. I think we, again, want to think that, you know, nothing really affects us. And I think the biggest lesson that I've heard, not just from myself, but from all the other sort of, you know, folks that work that night, is that recovery is a process, and it needs to be something that we are constantly thinking about. And as medical educators who train residents and medical students, that's something that we need to sort of reach out to them and say, look, it's okay. You know, it's okay to actually feel angry or upset about this event. And what we had was such a unique situation in Colorado, but what I would sort of say to the entire community is that that process probably has to happen a lot more, and it's something that we need to probably think about a lot more as both EM physicians, but then also as educators, is that we probably do need to spend a little bit more time not just teaching our residents and our medical students to suck it up and, you know, kind of move on to the next patient, but to sometimes actually sit down and really process what they're feeling.